The most recent survey data show that Laos has achieved the previously set national MDG target for under 5 mortality rate of 80 per 1,000 live births and can now set a more ambitious target for 2015. However, Laos still ranks amongst those countries with highest under 5 mortality rate in the region.
According to the recent survey, to achieve the child mortality targets that are more ambitious, Laos needs to continue its current reduction rate of more than 4 percentage points a year. This will require tackling significant challenges. The health experts explain that most child deaths in Laos are due to preventable and treatable conditions. An increasing number of children in Laos now have access to high-impact child survival interventions such as immunization and oral rehydration therapy, known to be effective in reducing child deaths and childhood diseases. Implementing those high-impact, low-cost interventions could reduce 2/3 of child deaths. Laos shows good progress on some interventions, but overall the coverage is still low. The greatest challenge will be to ensure sustainable and predictable financing for maternal, neonatal, and child health services. Another challenge will be to strengthen clinical and management capacity and development under supply and logistic management systems.
ลดลงการเจ็บเป็นของเด็กก็บ่ได้ขาดสารอาหารปานใดคือเก่า
There are several opportunities for accelerating progress towards national targets for the under 5 mortality rate and infant mortality rate. First, Laos has good overall policies that aim at expanding child survival interventions and reducing inequities in health services utilization among different groups. Second, the health reforms prioritize the expansion of high-impact, low-cost interventions to reach the MDGs. Large-scale implementation will be needed so that these interventions reach high levels of population coverage. Finally, Laos' steady economic growth provides growing fiscal space, which would allow an increase in the national budget allocation for recent costs. This should be sufficient to cover vaccines, other essential supplies, and the functioning of primary health care facilities, including health outreach services. However, to achieve the target by 2015, under 5 mortality rate should be 70 per 1,000 live births, and the infant's mortality rate should be 45 per 1,000 live births.